You think you might be pregnant and you're wondering how soon you can actually tell if you're pregnant or not. But here is the tricky part. Testing too early can give you a false negative result, and waiting for too long can keep you in an unnecessary suspense. So, how soon can you actually know for sure? Some women say you can find out just a few days after conception, whereas others insist that you must have to wait until you have missed your period. But here is the truth. It all depends on the type of test you take, be it urine, blood, or ultrasound. And each of them have a specific window of accuracy and specificity. Therefore, in today's video, we're going to break this down step by step. When a urine test can actually give you a reliable result, when a blood test is more accurate, and finally, when an ultrasound will confirm your pregnancy and dictate fetal heartbeat. So stay with me until the end, because understanding this timeline will save you a whole lot of confusion, heartbreak, and wasted effort. Hey, beautiful people, this is my field, testing and diagnosis. Welcome back to Good Life Medics, where we discuss all things women's health, from your periods to ovulation to trying to conceive to pregnancy. If this interests you, please like this video, click and subscribe so we'll build a wider audience, and we get started at once. Let's start with the most common option, an at-home urine pregnancy test, the one you can pick up at any pharmacy or medicine store. Now, this is the part that most people don't even realize. This test works by dictating a hormone called human chorionic gonadotropin, HCG for short, in your urine. But your body only starts producing a dictatable levels of this hormone only after implantation of the fertilized egg has taken place in your uterus. And this typically takes place about 6 to 12 days after implantation of this egg has taken place. That means if you test too early, let's say 3 to 4 days after sex, this test will most likely show a single line indicating a negative result, even when you might be pregnant. And that is because your body hasn't yet started producing the dictatable levels of this HCG hormone enough for this test to pick it out. Most test kits claim to be 99% accurate on the day of your missed period, but for the most reliable results, both in the US, your UK, in Nigeria, or anywhere else where early dictation kits are widely available, experts recommend that you test 5 to 7 days after you must have missed your period. At this point, your HCG levels is already high enough to be confidently picked up by this test kit. And it is best you use your early morning urine. Why? Because it is at this point that your urine is mostly concentrated to give you the best results. Therefore, the bottom line here is, though you can test earlier, but you risk having a false negative result. So it is best you wait for at least the day you have missed your period before testing. That is for urine test. Let's now get into the blood test. Next, let's talk about the blood pregnancy test. This is the gold standard of diagnosis in most clinics and fertility centers. This can dictate very small amounts of HCG hormones, sometimes as low as just 1 milli international units per ml of your blood. Unlike urine that needs a higher dictatable levels of HCG before it can pick it out, sometimes as high as 20 milli international units per ml of urine. Therefore, a blood test can give a positive result about 7 to 10 days after conception, which is roughly about 1 week even before you miss your period. There are a number of factors why a blood test gives a more sensitive result than urine test, including hormone concentration and dilution factor. So there are two types of blood pregnancy tests. There's the qualitative one and there is the quantitative one. Qualitative one is just the one that gives you positive or negative, just like your urine test as well. And there's the quantitative HCG test, also called beta HCG test. This one gives out or measures out the exact amount of HCG that you have in your blood. This one is especially beneficial when you want to monitor how well the pregnancy is progressing, especially in suspected cases of ectopic pregnancy. Okay, so the bottom line here is, therefore, a blood test is used when you need an earlier and more reliable answer, or if there are concerns about your fertility treatment, concerns about ectopic pregnancy or just a confusing urine test, you need to be double sure. Okay, so if you are anxious and you need a faster or more reliable answer, blood test is your earliest bet. And finally, the most definitive test, an ultrasound test. Now, you might be wondering, how soon can an ultrasound test be able to dictate and confirm your pregnancy? Well, it all depends on whether or not it is a transvaginal ultrasound or it is a abdominopelvic ultrasound. Now, with a transvaginal ultrasound, your radiologist can be able to dictate your pregnancy about 3 to 4 weeks after conception, which is 5 to 6 weeks, assuming you count from the first day of your last menstrual period. Hope you know that pregnancy is not calculated from just the day you think you conceived or from your ovulation. If you want to calculate pregnancy, you count it from that very first day you saw your menstrual period. That is how pregnancy is calculated. By this time, you might see the gestational sac and much later the fetal heartbeat. That is why most people are asked to come back 2 weeks later in order to see or check out for the fetal heartbeat. But before this time, usually an ultrasound test cannot dictate much. And that is why your doctor will not be requesting for this test so early. So why ultrasound is the most visual and conclusive test, you have to wait for it to be effective enough. Please, if you're finding this video helpful, drop your favorite emoji in the comment section. Drop any questions if you have any, and I will attend to you. Like this video as well. I need that your like. Thank you. So to conclude, a urine test is usually most accurate from the days after you have missed your periods. But if you can wait for up to 5 days after your missed period. Whereas a blood test can give you a positive result earlier. It can dictate as early as 7 to 10 days after conception. Whereas ultrasound, though it is the most definitive test, you have to give it time. You have to wait for up to 6 weeks in order for you to see both the gestational sac and the fetal heartbeat. Though in some pregnancy, you may have to wait a little 1 or 2 more weeks for you to see the fetal heartbeat. Remember, testing too early can give you confusion and unnecessary depression. So timing is very important. I have a previous video where I talked about 10 symptoms of early pregnancy, even before a missed period. So please, you can see that video. If you are still waiting to conduct your urine test, you can go through the signs to see whether you can relate it to what you're already having. And please give this video a thumbs up if it was truly helpful. Share it to any woman who might need it, and I'll see you in my next video. Thank you for watching.